In today's video, we are going to do three things. I want to prove to you how absolutely devastating low levels of heavy metal exposure is to the global population. And then second, despite what you hear in the alternative medicine circles, IV chelation is just not the answer to this problem. Finally, I'm going to show you a better way. There is a safer way to detoxify that I've been using in my clinic for over a decade. And that's the main thing that I want you to take away from. And we're going to go through about a half dozen cases from my clinical practice to show you how that works. And before I do that, this lecture was initially intended, and I delivered it to a group of practitioners, teaching them my approach to environmental detoxification. And so there's some nitty-gritty science here, but I've really come to realize from my patients, people are smart. And I think that the information is important enough to be out there. And if we have to risk a couple confusing slides, so be it. So let's dive in. We now know that low-level lead exposure kills more Americans than smoking. And it sounds shocking, but it's true. And the reason why is that although smoking by itself is more deadly than lead exposure, so many more people are exposed to low-level lead than smoke these days. Less people smoke overall. And so even though we're getting less people smoking, more people being exposed to low level of lead means a higher number of people that are at risk. So you can see here concentrations in lead in blood, it's just almost double what we can see from smoking. And I'm going to be focusing on lead for these first couple slides, but I want you to think of lead as a proxy for all of the metals that we're exposed to, right? Mercury, thallium, cesium, cadmium. We see a lot of heavy metals and we know that they're additive, but let's just, dive in looking at lead here. Now, the NHANES is just one of those wonderful, wonderful tools that we have from the US public health infrastructure. And we used to think that blood lead levels of 10, if it's over 10, it's a problem. And then the more we've looked at this, the lower and lower historically we've had our concentrations of lead that we know is safe. And so then it came down to 5, and now we're knowing even blood lead levels, at 2 or lower are problematic. And so we are thinking 400,000 Americans are dying in association with lead exposure every single year. And against what people used to think, it's lower levels. So here we can look at a chart. And if you look at the concentration of lead in blood, here at the very, very top, and particularly, let me point you to the cardiovascular disease mortality and the ischemic disease mortality. Look at these HRs, right? So we're coming on 1.7, right, for both of these. And then if you look at smoking, right, it's right there, right? Statistically, we're seeing they're right there. And that's, I think, shocking for a lot of people to see. But truly, this is a public health disaster. It's an emergency. It goes much deeper than just Flint, Michigan. We're seeing aging infrastructure. We're seeing contaminated supplements. And I think we really, really need to start thinking about our total metal exposure as a marker for how long are we going to live? What's our optimal health? Do we have a cardiovascular risk, right? How much attention is paid to your LDL is this, your blood pressure is this, right? How many doctors are getting a blood lead level, right? Such a basic, easy screening test. It's so often overlooked. So if nothing else, if we get a couple other doctors here to just order a heavy metal panel on your 50-year-old patients who you're already doing a cardiovascular workup, or if someone's getting a stress test, right, and you're checking their lipids, get their blood lead level. It's so easy, right? Let's look at another set of information. And these are Kaplan-Meier survival estimates. So for the physicians among us, obviously, this is something that we're used to seeing in public health literature. And what this is for everyone else is you're looking at survival probability here on the y-axis, and you're looking this over time. And so if you have something that really is not associated with less survival or more mortality, you should see like a straight line. And then the more hazardous something is, you see a steeper decline. So what we're looking at here is quartile 1. So if you take all Americans and what is their blood lead level, and you take the bottom 25%, you do see an association over time with mortality But then look what happens every single time you go down a quartile. Look at our overall survival, right? It's big time, right? This is a 25% difference in survival, right? Again, for all those doctors, obsessing about, mitochondrial function for longevity and all these esoteric drugs, what's their freaking blood lead level? And here again, I should say, these are the quartiles here at the bottom. Quartile 1 being a blood level less than 1.2, the highest being 2.5 to 4. So we're seeing a direct relationship here, really significant. And this is just another way to look at the data, right? If we compare quartile 2 to quartile 1, right, a blood lead level here, or 2 to 1, we get a 22% higher risk of death. And then every single time we bump up the blood lead, we see higher increases in our mortality rate. And these are not high levels. I mean, it is not uncommon for me, for random adults who are pretty healthy without obvious exposure, to see blood lead levels in the third quartile. It's really something that we need to pay more attention to. So what level is appropriate to our patients? We know there's no safe amount, right? But is there a way that we can start to say who should be treated and who should not be treated? And here's one way. The first thing to do is you can say there is no safe amount of blood lead, right? We know that from studies. We know that from pediatric literature. We know that from the mortality data I just showed you. And so it's perfectly reasonable if there's any lead in the blood to detoxify. And we're going to go through the program that I would suggest to you. But if you're looking for a definite cutoff, I would suggest 2.0. 2.0, I think, as a conservative place where you are absolutely jumping your blood lead, because we know that cardiovascular risk is really going up, in a dramatic way when blood lead levels get close to that 2.0 mark. And so you could consider optimal blood lead 0. You should consider treatment when levels get above 1.2, and you absolutely should be dealing with this when your patient's blood lead level is 2 or greater. How do we test for heavy metals? All right, here is the $1 million question, and I really hope this gets some traction. Please, please, please do not get provoked heavy metal testing on your patients. And if you are a patient who has had provoked heavy metal testing, here is why that is nonsense. In my 15 years of practicing functional medicine, have never seen a normal provoked test. Patients bring this in all the time. There are clinics across the country, and I have never seen a normal test. And if you've never seen a normal test, right, that means you're getting false positives all of the time. And we don't know if that's a problem or not, because we don't have a range to compare a provoked test to. So when you get, this is a doctor's data heavy metal panel, and you'll see provoking agent here, DMSA or EDTA. There's a lot of different ones that different clinics use. But the idea is these chelating agents pull metals out of the system and put them in the urine. That's what they do as a chelating agent. So the patient gets the chelating agent, and then they get these horrible, scary, right, levels of metals in their body, and then the practitioner pressures them into IV treatment. This has to stop. It's garbage, right? There is no normal range. We don't know if this is a problem or not. And the truth is that I am only seeing doctors who sell IVs do this. The honest truth is they have a financial incentive to sell expensive IVs. It's in their benefit to have a scary looking test to scare you into treatment, to scare you into more labs. It's really shameful, and I think it really needs to stop. So if you are getting this from a doctor, I think it's a huge red flag, and you should look for a second opinion. Here's what I do. I recommend getting a blood draw, and this can be done at any standard lab across the country. We have lead, mercury, cadmium, and arsenic are the 4 that are commonly done all the time. And I like to pair that with a non-provoked first morning urine test. So I have the patient wake up, they pee in the cup from doctor's data. It's the lab that I have the most trust with. and it's a random sample first thing in the morning. Screw that in. They're going to FedEx or whatever that back to doctor's data, and then they're going to go get their blood drawn. And the idea here is that we're going to have a urine sample. What are they excreting at this moment? What's been their recent exposure like? And what is their blood level? Is there a correlation? Do we see it only in the urine? Do we see some in the urine? Is it both? And this to me is the most accurate, inexpensive, safe way to do it. And we have standard levels of heavy metals that we can compare it to. So we know if I see a blood lead level of 2.0, I know what that means, right? If I see a urinary cadmium level, guess what? We've got a range, right? The NHANES data that we saw earlier, we can compare our random first morning urine with data from other Americans. And that's what I think we should be doing. We should be skipping the provoked test and use a test that we can compare. Where are you on the dartboard? Are you at the highest quartile? Are you really low and it doesn't really matter? This, I think, is the best way to do it. The other thing that I'll say about this is that urine testing is going to pick up heavy metals that we don't have the ability to test for in the blood. So in particular, arsenic is not accurate in the blood. You want to see it in the urine. You're going to see different forms of mercury in the urine than in the blood. And then you are going to be missing cesium, thallium, palladium, platinum, all sorts of heavy metals that we just don't have the ability to find in the blood. So you really want to do these two together. Now, this is for the physicians among us. This is what I tend to use in my clinic. And I'll just leave this here as a general reference. I'm not going to read it, but the idea here is, what is the 90th percentile of the urinary heavy metal excretion, right? It seems to me that we have some fluctuation based on what we're exposed to, how well we detox, hydration levels. But when a patient's at above the 90th percentile for a heavy metal, then that's when I start to get concerned. And so these are the 90th percentile of adults from the NHANES data, right? You can find it here, the fourth national report. This is adults 18 and older, and these 90th percent of the population. So we can use these as an idea of, are we in trouble or not? And then here's the same thing for heavy metals in the blood. And I included the 50th percentile of the population because I'm aware that more practitioners are just going to get a blood level and maybe not going to go that extra step of the urinary metal. So we want to know when we see a blood lead level, of 0.9, you're already at the 50th percentile, right? That's not so great. The last thing I'll mention is that we've got really good data on urinary cadmium. This has been used in the past to track smoking, right? Because we know that cadmium is a nice byproduct of burning all those combustibles in cigarettes. But we know that the hazard ratio for having a urinary cadmium above 1.86, the hazard ratio, urinary cadmium above 0.9, you have a hazard ratio of 1.86 for a heart attack. That is really high, right? That's a big time hazard ratio and really, really would be concerning any single time you do that. And I think that's a really good data point for your patients to have. Okay. Here is what I consider the basic program for treating heavy metals. We're going to talk about the rationale, what we do, and then we'll go into the details here. And for the patients, I've taken out doses. This is not a self-help guide. This is not me being your doctor. I took out the doses because I really feel strongly that detoxification should be guided by physicians, right? You should have testing underdone by physicians who are qualified to interpret labs. You want to be working with someone with experience, and you want to be working with someone who knows what they're doing if things go wrong. So this really should be done with a doctor, but I need this information to be out there to kind of advance the field here. So here is what I suggest we should be doing in the field. We should be doing 1, 2, 3. The first thing we do in toxicology is you find the source. You remove the exposure, right? The treatment for poisoning is to not be poisoned, right? It's not esoteric treatments. It's if there is a whole bunch of cadmium and lead and all that chocolate you're eating, guess what? Stop eating the chocolate, right? So you find the source whenever we can. And with some investigation work, we can find the source a large amount of the time. It's kind of fun. You get to be House MD and Sherlock Holmes put together. But it's really fun when you get to find these and you can really help your patients. Number 2, you have to make sure the fundamental tenets of your patient's lifestyle are in order. And I'll tell you what I mean by that. But it's really important that doctors stop just jumping right to aggressive treatments and they set the stage for those treatments to work. And this is something I preach about a lot. I feel very strongly about it. If doctors slowed down a little bit and kind of took their time with the lifestyle, they would find every subsequent treatment that they did is going to work better. And that would lead us to the general program. So the general program for detoxification is going to be twice daily probiotics and binders, oral binders, taken for 90 days as one round of detoxification. So let's dive in and see what all that means. Okay. All right, here's the fun part first, though, right? Where are the metals coming from? So this is a list that I've informally gathered through different patients. And we'll just go through this quick. Vaping. So we know that it's the filament from the vape, just as much as the oil from the vaping. And the filament is putting off all sorts of little heavy metals. And so if your patient is vaping a lot, you'll want them to quit, obviously. This is one of those things where you may go from the frying pan into the fire. We're trying to be a little healthier by vaping, but perhaps we're exposing ourselves to new toxicants. Sorry for coffee drinkers. If you're drinking cheap disposable coffee pods, all of those Keurigs are laced with heavy metals, surprisingly. So we see a lot of nickel and lead, cadmium as well. So if this is a cup a day, it's not going to be a problem. But I know a lot of people who do not stop at one. It's going to chunk, 4 or 5 a day. And that will get you over your amount quite a lot. Plant-based protein powders is a big one. So I'm primarily talking about the vegan or vegetarian plant-based protein powders. Google this. It's horrific. You'll find a ton of here. Pea-based protein, rice, hemp. These are all kind of a disaster. And it has to do with both the concentration of what they're having to do to process the plants to get an adequate amount of protein in them, and then how they're subsequently processing them into a powder. So be on the lookout. I don't have anyone in my practice on a plant-based powder if I can help it. You'll find imported herbal products. Even Chinese herbal medicine, unfortunately, is contaminated with metals. Dark chocolate. Here's the bad news. I didn't lead with this because it's so depressing. But look, a serving of Hershey's, 265%, all the lead you can want in a little chocolate bar. And it's not just regular generic chocolate. Look at the extra fancy Trader Joe's, right? We all know that the cacao, more cacao means more antioxidants, right? And so we want the darker the chocolate, and that's healthy. The darker it is, usually that means more lead and more cadmium. So really be on the lookout here. We'll go through a case report later. I'm finding patients who I think are being exposed to heavy metals, thallium in particular, uranium to a lesser extent, and I think it's coming from fracking. So as industry is developing and they are injecting water into the crusts of the earth, that water then rises to the surface and can contaminate wells and agriculture with the heavy metals that come from the crust of the earth. And so I think one of the things that fracking is doing is exposing all of us to more heavy metals. And this is really unfortunate because the heavy metals of concern that I'm seeing, thallium and uranium, you can see them on the doctor's data urine test, but it's nowhere to be found on blood. It's not being tracked by public health authorities, right? So here in the state of Louisiana, where I'm from, if I order a blood mercury and it's over a certain level, the state will call the patient. They'll contact me. They'll say, hey, Dr. Joe, your patient's got a blood mercury of 15. Do you know where it's coming from? Are you on that? There's nothing to be had in that way for some of these other heavy metals that I'm really worried about. Okay, food. So I said hidden sources of heavy metals, and I know I put fish there, but this is just so common that I just can't do a presentation and not say it. Tuna fish sandwiches, sushi. We think of this as healthy, but you will find lots and lots of patients with really high problematic levels of mercury, with just a couple servings of fish a week. And I think there is a genetic component to how well some patients can detoxify this. I think there can be a nutritional component if they're low on the metal selenium, which can help detoxify mercury. But I just had to kind of put fish there. And then I want to highlight kale. So kale, other than being disgusting and cardboardy and gross is full of heavy metals. It really sucks up cadmium and lead from the ground. It like bioconcentrates it. So what you'll see is some people who read online from, this is the healthiest food you can eat from a cardiologist. And they're slamming, 2 or 3 servings of kale in a green smoothie. And they come in with outrageously high heavy metals. The same thing can happen to a lesser extent from spinach, but really be on the lookout for kale. It's a big problem. And then I'll mention close proximity to highways, industry, and factories. Heavy metal, we can obviously be exposed through food, but also through air. I think air pollution is not given as much weight as it should be. And I'll show you some more evidence why I think this is a problem, but I thought this would be an important slide to really go through. All right, so we are looking for sources of heavy metals, and we are removing those from our patients, but then we have to get the lifestyle right. And so before I tell you the protocols for metals, if your patient is not sleeping, they're detoxifying, right? You need to make sure that they don't have sleep apnea. You need to make sure that they don't have upper airway resistance syndrome. They should be getting 8 to 9 hours, and most patients do not get that. We now know that the brain pulses as we sleep, and it pumps out gliolymphatic fluid, right, out to the body so that it can be detoxified, right? So all the cellular byproducts and the nasties that we don't want accumulating in our brain, when we sleep, we are physically pumping that out. So if you sleep for 5 hours, you get 5 hours of brain detox. If you sleep for 10 hours, you get twice as many, right? And this is pretty fascinating because we see in the medical literature a very direct relationship to the amount of sleep someone gets and the risk of getting Alzheimer's dementia. So the less sleep, the more Alzheimer's dementia. And I think detoxification of the brain from metals is a piece of that. Okay, GI. Do not detox a patient until they are pooping every single day. Maybe this is obvious to some practitioners, but this is just a no-go for me. You are making them poop before you detox. And by that, I mean 1 to 2 bowel movements, easy to pass a day. In some cases, if they are on a low fiber diet, you can get by with 1 bowel movement every other day if they are really truly eating a lower fiber diet, but you really want to make sure they're not backing up and retaining stool. Sauna is a wonderful way to detox. There are patients out there that if you do all of this and you put them in a sauna, their metals will clear, and you don't need to throw supplements at them. It really can be as simple as that. If you do the lifestyle, they're getting adequate sleep, they're eating a healthy diet, they are pooping, and they're sweating, they're going to get better. So I think we just want to always make sure that we are doing right by our patients in that. Last but not least, on the wall here in my office, I have a biochemistry map of all human biochemistry. And it's got the Krebs cycle and how we make steroids and how we break down red blood cells. And it looks like this crazy convoluted subway map. And it's almost 5 feet wide and 4 feet tall. It's huge, right? And what I want it's there right behind me, because what I want patients to know is when they come in and they're on 15 supplements, and you can imagine just throwing a trash bag full of supplements in that 5x4 poster of biochemistry, it messes things up. And so before you really are asking patients to go on a program, stop any meds they don't need, right? I see people on all sorts of hormones they don't need. I see people on all sorts of supplements they don't need. And we want to make things easy for the body. So whenever possible, please, 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 wean and stop supplements and meds that they do not need. Do it for me. It'll make me happy. Okay, this gets to kind of step 3. So we've done lifestyle, we've done exposure, we've done lifestyle, and now we are talking about the active treatments. So you'll see 3 bottles, 1, 2, 3 of probiotics that are going to be given twice daily. And then you're going to be seeing 1 bottle of binders that's going to be taken in the middle of the day. Now, big disclaimer. I've worked with Dr. Jeff Moss and his wonderful wife, Joanne, from Moss Nutrition for a long time. They are friends. They've helped my patients for a long, long, long time. And they helped me formulate ProBind. So I made ProBind. And so I'm very biased. I think it's the best binder on the market, but that's my formula, right? So I would be amiss if I did not say that. Moss only sells to practitioners, right? So this isn't something that you go Google and buy. Again, that's done in large part because we want products to go to patients when there is a doctor tracking their treatment. But probiotics and a binder is the mainstay of getting heavy metals and other toxins down. That's kind of the secret here. Let's talk about why. So probiotics are like my favorite treatment in the world. And it's almost impossible to leave a consult and me not want to be putting someone on probiotics. And they just do everything. And there's another video that I'm very proud of that I'd love everyone to watch and share. It's just literally probiotics do everything. And it's not like, in a test tube. It's like, here's a meta-analysis of 12 studies showing it improves, blood sugar and depression and constipation. And so watch that. Probiotics are amazing because the outside of the probiotic has really particular properties, and certain species are able to bind directly to toxins. In this case, lead. And it's cool because it doesn't matter if the probiotic is alive or dead. We're talking about, if you go to Whole Foods, they'll upcharge you can buy the probiotic in the refrigerator, right? You pay twice as much. But guess what? It doesn't matter if it's alive or dead. When it hits the stomach acid, it's dead anyways. But look at the lead binding abilities of living bacteria versus dead bacteria. I mean, it's phenomenal, right? We'll see certain species are standouts, right? You'll see certain bacteria do it better than others, and that's why I've picked certain species to be in my binder. But we know that probiotics will directly bind onto heavy metals. What else do they do? So not only do they directly bind to metals, they make you detoxify better. And they do that by treating the liver, the microbiome, and how the body gets rid of toxins. And so this is kind of a complicated slide, but stick with me. So there's something called the enterohepatic recirculation or circulation. And what this means is that the human body makes bile to help us digest foods, but it's hard to make. It's expensive. It's biochemically expensive to make. And if you are going to be dumping bile into your gut to help you absorb every meal, and you just poop all of it out, then you have to make more, and then you can very easily run out. So the body has evolved so that 95% of the bile gets reabsorbed, kind of repackaged to reuse. Okay. And that's all fascinating and stuff, right? But why am I talking about this? The little green dots here represent a toxic burden, right? Heavy metals, lead in this case. And so as lead comes into the body's trying to deal with it. And then some of those go to the liver for detoxification. And the liver will excrete those toxins with the bile. They'll become attached to and associated with the bile based on the chemical properties of the molecule of bile. But because that bile salt is reabsorbed, 95% of it, it brings the toxins back into the body, right? And so we need a way to disrupt this. And that's where a binder will come in. But the other thing that we can do is give probiotics. So probiotics, especially those lactobacillus species, what they're going to do is they're going to make more bile acid synthesis. So you can excrete more toxins out, per meal. It's going to enhance the bile flow. It's going to make glutathione, right? Everybody's favorite molecule, glutathione. You don't have to take it. Just take probiotics and your body will make what it needs. And then it's going to help you actually remove more of the bile acids out through the exit instead of going up into the recirculation. And this was done on a really, 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 really cool study on mice. And so this is a simple diagram of the enterohepatic recirculation in those mice. And Lactobacillus plantarum was shown to directly decrease the amount of lead in the mice. So really, really neat stuff. And I see this all the time in my human patients. So you don't have to be a mouse to benefit. Now, what is the evidence for specific substances binding heavy metals? It's not just charcoal. That people kind of know is that one. It's not just the probiotics that I talked about, but we really want to look at the other really well-studied substances. Chlorella is extremely well-studied to bind to heavy metals, as is bentonite clay. And the big thing that's so important that I would kill to just be able to lock all the functional medicine doctors in a room and just explain something very, very basic, which is a test tube study is not as good as an animal study, which is not as good as a human trial. Those are not equal amounts of evidence. So when a supplement company or a functional medicine doctor gets all, excited about a test tube study, that's kind of weak sauce, right? Whenever possible, we want to be relying on animal trials. So does that substance actually work in a biologic system? Even better, does that substance work in a freaking human system? So we're looking for those ingredients, those substances that are showing to work in humans. Okay. Now, so we can see there are excellent studies on charcoal and chlorella in human, and then a good amount of information on animals for these substances. And I have no doubt that in a few years, when we get more word out about how critical probiotics are for detoxification, not just metals, but other chemicals and other toxicants, other endotoxins, mold toxins, we are going to get human trials as well. That is coming soon. Do not worry. But not all evidence is the same, and it shouldn't be treated the same, particularly if someone's trying to sell you something. Okay, off my soapbox. Okay, this is the formula that I made. So this is the binder, and I wanted the best studied ingredients from the medical literature in it. And that's why these ingredients are here, and that's why other ingredients are not in it. There's no zeolite, there's no silica, there's not the other things that are not well studied. There's no humic acid or fulvic acid. Those things are not well studied, or they're clearly inferior to these ingredients. So the way I made this work was I wanted everything to be very clear. It's not a proprietary blend where just trust me, I put good things in it, right? It's not a sprinkle of the most expensive ingredient and then 99% the cheapest ingredient. I wanted everyone to be able to see exactly what happens when you take 4 capsules, you're getting this much. You'll also notice that if you take 1 capsule, you can have a quarter dose, right? And so this is for my sensitive patients who can't go fast. Oops. Well, I guess we'll give a heart. This is for my sensitive patients. You get a heart. But my sensitive patients can't always take 4 binders, right? They may only be able to take 1 or 2. And so I wanted them to know I get 100 milligrams of each of these main ingredients if I take 1 capsule. These are the probiotic species whose cell walls have evolved such that they bind to the most toxins. These are the best studied probiotics in the literature. And even though these species are in the other probiotics, I want extra. We want as many of these good guys as we can get throughout the day. It makes a big difference. The other thing, last point here, is that you want probiotics with these other ingredients. You want to make sure you're promoting regularity, that you're not getting backed up or constipated. And so you really want there to be probiotics in the same ingredients that you're using to detoxify metals. There are some extras that I'll throw in. So I mentioned to you that 90 days on the probiotics in the binder is like 1 round. And that generally drops urinary and blood levels by 50%. We'll see the case studies. But sometimes you need more, right? Sometimes you do that and you can't find the source and they've gone down a little bit, but you want to give them a little extra push, or you're really worried initially. Some of the other considerations I have when I'm formulating a program is a multivitamin twice daily if I think someone is nutrient deprived. N-acetylcysteine is a really good adjunct to add. Green tea, I'm actually drinking, putting up my money where my mouth is, 2 to 4 cups of green tea. This is something that can improve glucuronidation. Dr. Nathan Betha O'Hara and I learned this through some research. This is one of the most powerful foods that we can use. It's not necessarily the methylation that we care about. It's actually the glucuronidation, and green tea is one of the best ways to upregulate that. Epsom salt baths or sauna. Again, there's a sauna. And then liposomal glutathione. I put use with caution because patients who are living in moldy homes or have high levels of urinary mycotoxins, this will make very, very sick. Now, if a patient just has heavy metals and I'm not concerned about mold toxins, then I feel more comfortable using glutathione. Particularly the younger someone is, the more resilient they are. But in general, this is not first line for me just because I see very sensitive, sick patients, and I do not want to throw them under the bus and make them worse. We never want to detox more than the body is ready for. So I almost always want to know, how are they tolerating the first round before I would give the aggressive glutathione? Is it, I would never want to go too fast. I would rather do more later if we're not getting where we want to. Now, here's how I think of dosing when I'm detoxifying. And that is that I want the probiotics morning and night, right? You want all those wonderful species to come in. You want all the benefits of the probiotics for detoxification. And then people have other things. They may have blood pressure medicine or thyroid medicine or antidepressants. You take those morning and evening. Then you separate those and you take the binder in the middle of the day with lunch. There's a big eternal debate. Should it be with food, without food, before a meal? It doesn't matter. You just have to get it in. And so take it at a time where you're going to remember every day. So for most of my patients, it's with lunch, right? And I will take it the same way. I have my binder of bottles. My bottle of binders are right here on the desk so that I remember to take it with my lunch. And this way, you do not have to worry in the least if the compounds in ProBind are going to bind to medications. Now, this is a theoretical concern. I've never seen any clinical problem with charcoal clay, chlorella, Saccharomyces probiotics binding to antidepressants or blood pressure medicines or anti-seizure medicines. I've never seen any of that. But I think we deserve to be safe and conservative until we just know more, because this is a new area of medicine. This is, I think, something up and coming in environmental medicine and in functional medicine itself. We want to be safe until proven otherwise. So in 5 or 10 years, we're going to have more information. But until then, let's be safe, right? Let's be safe, conservative, and treat our patients how we would want to be treated, right? No harm. First, do no harm. That's why we're not slamming them with IVs when you can do something so easy and safe. Okay, best part. Here are case studies from my practice. Got to get the green tea in. Okay. All right, here's a fun one. Here's a 42-year-old male, and he was referred to me by a colleague, a local integrative psychiatrist, and she is a genius, and she had done everything she knew. Bunch of medications, bunch of supplements, had done the lifestyle, had done the gut work, had done testing, and this guy was suicidal, non-functioning, kind of bedbound, on the verge of losing his job. And so I took him in as a client, and first visit, just talking to him, trying to figure out, what the heck was being missed. And, as a functional medicine doctor who does environmental medicine, and I treat a lot of patients with chronic fatigue, a lot of patients with chronic GI issues and just symptoms that don't make sense, and they've all seen a bunch of doctors, I have to look for the reasons why they're sick. And heavy metals and mold are most of that reason why. So it doesn't end up being that much of a mystery for a lot of patients. He's a good case why. So this guy was doing great until COVID. At first, it was like, you're just depressed because you're working from home and everything's different in COVID. But he had a physical reason for his depression. He was growing and eating a whole bunch of vegetables from his garden, and his soil was full of lead. I can't for the life of me find his blood lead level. It's driving me nuts. It was around 15, maybe 20, and his treatment was easy. So we stopped the homegrown veggies. He got probiotics, oral binders, and within a week he was better. And then he was back on his feet, completely better in 3 months. So this was a really fun case of, what did we do, right? We listened, found the reason why. He stopped that. He had already done the lifestyle work and got the general support. And then we gave him a simple, basic treatment program, right? And that's how it goes for a lot of these cases. You'll see this is kind of fun to do. So if you are a practitioner, I encourage you to start learning more about environmental medicine. All right. So here's one of the reasons why we have to be careful of vegetables grown near highways. So this was in Turkey, and this is just more a watch out for kale kind of slide. The takeaway here is the closer that they grew the arugula and kale, the higher the cadmium, lead, and mercury were. So if you have a backyard garden, but you live within a mile of a highway, I would be concerned. Here's another case. So this is Joe, and he's got a case study and testimonial on my YouTube that you can check out if you would so desire. And I first saw him in 2023, and he came in with a condition called chronic idiopathic urticaria, and he was pretty hopeless. He had seen a whole bunch of doctors. He had been on all the meds, everything, steroids, drugs, Dupixent, done lifestyle, gut, everything. And he was really depressed. I had to convince him to come in. I was like, I think there's some things we're missing here. I'm glad he did. Another thing is he developed unexplained alopecia, hair loss, complete hair loss in his 20s. Not just like receding hairline, male pattern baldness, genetic, like no hair, right? A little bit different. And he had had previous environmental exposures, right? So moldy home in a rural area near farmland, right? So what is the pesticide? What is the glyphosate insecticide exposure like? Is it a case where it's some metals, some mold, some pesticides? I think yes. You'll see these together, by the way. Like here. So I did some environmental testing on him, and sure enough, he had a urinary thallium level well over the 90th percentile at 0.52. And again, this is the doctor's data range. I really like the lab. They do a great job. I don't trust all of their numbers for their references. I think you should go an extra mile and really look at the NHANES data, because I think you could very easily look at 0.52 and say, you're just a little bit over. It's okay. Yeah, that's bad. So 0.52 is not a good number. And then we see, honking high ochre toxin. So he's got some past or current exposure to mycotoxins. 5 out of the 5 were present for a grand total of almost 16. All right, so decently high on the mold toxin as well. So he's got a big toxic burden. So we treated it. Here's a little aside. There is a link between thallium and hair loss. And we know this in some of the case studies of thallium poisoning, like Russian dissidents is scary enough to know, but some of the classic poisonings with thallium from the Russian government, you'll see complete body hair loss. And I think this is happening to a lower extent in some people who are vulnerable. I think this is some of the hair loss that is just unexplained cases is related to thallium and other heavy metals. And I think we're getting low-level exposure over time promoting the hair loss rather than one big, poisoning. But there is a link here, and I'd like more people to investigate that. So if you're a scientist with millions of dollars, give me a call and we'll make a study. So what did we do? I treated him for his toxins. So the same thing, right? We couldn't find obvious sources for his thallium levels, and so did the lifestyle, made sure that was where it needed to be. Probiotics and binders were the mainstay of Joe's treatment. And so we began in October 2023, right? There is where we have this 0.52. He started feeling better pretty quick. 2 months in, I feel like I'm a new person, right? That's what you're looking for in functional medicine. You're doing it right when they say things like that. 4 months in, I'm feeling 100%. And this is the point where we were able to bring him off some of his medications. So he was on a decent amount of prednisone just to be upright and getting him off the antihistamines. By April, off prednisone completely, no hives. And so this is a guy who was not functioning, really struggling. He's traveling, he's exercising, and a year later, everything great, no issues. He continues to do great to this day. And here you see a big drop in the urine thallium, right? And this is the sort of thing you see, particularly when there's no obvious ongoing source and you treat it properly. This is the sort of drop you'll see, right? And so 90th percentile, he's now well under. So go Joe. Case 3. Okay, this is another patient that I'd worked with for quite a while, and he had mold illness, and he had a lot of the issues related to mold, and we treated the mold, but he wasn't significantly better. And when you're treating a patient and you've treated the right thing, they get better, right? I feel like a new person. I'm off medicines. There's no ifs, ands, and buts about it. They just get better. He was slightly better, but not anywhere near I would expect if just mold was the cause. And so I said, what the hell am I missing? And we went back through. What could it be? Metals. And so it turns out he had been a fly fisherman and did like tours for years. And he would just climp those lead sinkers on the fishing line with his teeth. And so the first time I looked, his blood lead level was 6.2. Remember that 2.0 was the time where you start to say, ooh, maybe we should treat. And so we started treating probiotics, oral binders, really simple, right? I did not treat him with IV chelation because it's unnecessary and expensive and has a lot of side effects, right? So from October 25th to January 10th, we get more than a 50% drop, and blood level continues to come down. And guess what? He began feeling better. And that's what it's about, right? We see it's not just about, medicine is not about moving numbers on a paper. I know a lot of functional medicine doctors get obsessed with the T3 is this, and your CBC is this, and this marker says your kidneys, and they chase all these numbers around, but they forget to just listen, because if you treat the right thing, they're going to get better. So he got better because we treated the right thing. Here's another one. This one's interesting. I want to teach you the link between palladium, diabetes, and allergy. So this is a 68-year-old female, and in her young adult life, she developed chronic fatigue. And this was after she had 4 wisdom teeth removed, and she wasn't the same afterwards. And she came in to see me for pretty uncontrolled bad diabetes with retinopathy and neuropathy. And doing the full history, she had a white gold ring on exam, and we found out she had a room full of antiques. And she has this history of elevated eosinophils, right? So for non-clinicians, this is a type of white blood cell that specializes in allergy. And no doctor could figure out why it was high. So I wanted to take a look at some of the things that I knew could contribute to these issues. And so we did the doctor's data urinary test, and she had a urinary palladium level of 2.1. Highest I've seen, very, very, very high. And we think white gold has some palladium in it. I think we know for sure that some dental implants and dental hardware and spinal hardware can have some of these metals in it. And I think antiques in particular worry me too. So I don't know exactly where this is coming from, but we gave her probiotics, ProBind. In this case, I decided to give her extra nutrients because of some of the pre-existing conditions. And we see a big drop, right? 80% drop, mathematicians, something like that. Now, the thing we want to know here is that some of these metals that are being used in hardware can cause allergy. We see this with nickel, classically. We'll see this with palladium, uranium, thallium. The other is that the more heavy metals you have, the more likelihood for diabetes. So I think that when we see that cardiovascular risk, it's not just, is it directly toxic to the endothelium? It's, are the heavy metals really having a negative metabolic effect on the body? Are they obesogens? Are they upregulating allergy? I think they're doing a lot of these things under the hood and really making things hard for people to heal. I had to put this one in here. This patient did not have the worst blood lead level, right? This was not giving her symptoms. The urinary lead level, I forget what this is somewhere, I think it's the 50th or 60th percentile. So it wasn't the worst, but she was not doing great. And this all came from a very healthy, all you need protein shake, right? It's as much lead as you can get in your protein shake. It's a plant-based protein shake. And a lot of times the key to finding this one was, is there anything you're eating every day? Is there anything you're drinking every day? Is there something that you always use? And this is often a good way to find that source. Oh yeah, doc, I'm using 2 scoops of that greens powder. Yeah, doc, I'm doing that protein thing. I eat Hershey Kisses throughout the day, doc. Oh yeah, well, I fire pottery 3 times a week. You'll find the answer if you just kind of ask and listen. So I think now I've convinced you that number one, heavy metals are a huge problem. This is a global problem. This is an epidemic. This is getting worse. I hope I've convinced you that using chelating agents to diagnose metal toxicity is a loser's game. It's scientifically not accurate. It's done to sell things and make people afraid. There's not scientific support for doing it, and there's a better way. You can get accurate levels by simply peeing in a cup in the morning and doing a blood draw, and that's actually going to inform treatment because those levels, they track with treatment, just like the cases you saw here. I think I've convinced you that this is a pretty simple process, right? Find the source, get rid of it. Make sure you're not neglecting lifestyle. Treat with probiotics and binders. 90 days generally is a 50% drop in the levels. If there's not a drop, you're probably missing an exposure, or maybe you need to recheck, are they actually doing what you asked them to do? And maybe they need some of the extras. Maybe you want to add on the multivitamin, the N-acetylcysteine, or maybe glutathione. So I hope this is helpful for everyone. I hope this is interesting. And I hope this helps everyone treat their patients better. And I hope if you're a patient, I hope it helps you kind of advocate for yourself. Ask your doctor. They don't have to know anything about heavy metals. Get a blood lead level. If nothing else, that's going to save some lives. So please share this to anyone who may not have their blood lead level checked, and anyone who maybe has undergone all that IV chelation. There's a simpler, easier, safer way. Thank you.